Alrighty, I think we can go ahead and get started and people can trickle in. Thank you for taking some time to come tonight. My name is Lexi and I'm the marketing coordinator at HRC Fertility. And Dr. Zouves is just going to be giving a little presentation on holistic IVF, and then we will have plenty of time for questions at the end. So Dr. Zouves, if you want to take it over from here. Oh, you got to unmute.
Thank you, Lexi. Welcome to everybody. And my name is Dr. Christo Zouves, and this presentation is coming to you from our Silicon Valley area, actually from our Foster City location. And tonight we're going to be sharing with you the concept of holistic IVF. Now, what do we mean by holistic IVF? We mean that we start with optimum health, and then we add maximum science, and together those two areas then will get us the very best chance of a successful pregnancy. So I've been doing IVF now for 40 years. I did my first egg retrieval in 1984, and I bet many of you weren't actually even born at that time. So I've done maybe 15,000 egg retrievals in my IVF career so far, and I've been privileged to be responsible for many thousands of babies over this time. So holistic IVF is really close to my heart. My mum was a yoga instructor for most of her life. She taught Hatha yoga in the Iyengar system. So I've been aware of optimum ways of eating, of exercise from a very early age. And it was logical for me when I got into assisted reproduction back in the mid 80s to incorporate what we're going to talk about under optimum health in a few minutes. Remember, Lexi will be taking questions from you. You can pose your questions in the Q&A, and we will then have time at the end to go through almost all of your questions if we have time. So let's give you a little bit of the history here. So I've been practicing solo as an IVF doctor in the Bay Area here since 1999 as Zouves Fertility Center. And I have proudly become the newest member of Huntington Reproductive HRC Fertility. And this happened at the beginning of this year. So we have our location here in Foster City. We have the same team that I've been working with for all these years, as well as all the additional help that we now get from corporate HRC, including being able to work with Lexi. So you'll see to contact us to set up a consultation. There's an 800 number, which we'll show you again at the end, 800-800-1160. You can also reach us through the website, goivf.com, and that way you'll be able to set up a consultation. So I'm really excited to have joined this amazing group. They are ethical, compassionate, and I've known many of these other 22 REs in the group for many, many years now. We've looked after patients together, and many of them I've never met up until recently face to face. So ZFC is now proud to be a part of HRC. So we're going to talk first about optimum health. And under optimum health are most of the things that you can actually do for yourselves in preparation for either getting pregnant naturally or getting pregnant through whatever assistance you might need. And the ultimate final common pathway when everybody has tried all of these optimum healths and the less aggressive treatments, the final common pathway is IVF or in vitro fertilization. Now, why is optimum health so important? You know, we are what we eat, and we're going to be talking about diet a lot this evening. And there's a huge push worldwide to basically look at not extending lifespan, but extending health span. We need to be paying attention to all of these factors we're going to touch on, not only so that you can live a healthy, long life to be able to look after the children that we're looking to help you make, but also so that you can make together the best eggs and sperm and embryos that you possibly can. So, you know, we live in California. We live in an area where you can easily access organic produce. We really have no excuse. It doesn't mean that we shouldn't be looking very carefully at labels and where the food comes from. We want to try and source our food grown locally in an organic fashion because, you know, there are large corporations out there that are cutting corners and producing produce that's either highly processed or may have, you know, harmful additives like pesticides and the like. So try to make organic choices wherever possible. If you've really been pretty lax in how you've been looking after yourselves in the past, you want to be looking also into doing a cleanse or doing a detox. So when it comes to diet, no question, we want to try and eliminate gluten and dairy from the diet. Gluten is the protein in wheat, barley, and rye. And the thing in dairy that's not good is casein. So you want to avoid milk and cheese, but I would like you to take Greek yogurt because it's a really amazing food source. It has amazing probiotics in it. And so Greek yogurt is the exception. So we're going to talk about gluten and dairy-free diet. We also want to be as low as we can in sugar. Sugar is probably one of the most important contributors to ill health, to obesity, and also to the earlier onset now of dementia that we're seeing, you know, across populations in the developed world. Ideally, we want to eat as low of a carbohydrate diet as we can, and you want to eat a diet that is high in vegetables and protein, and as I said, as low as you can go on the carbohydrate, especially if you're looking to work on your BMI or your weight. So diet, extremely important. We want to focus on all of those healthy things that are gluten and dairy free. We want to focus on the healthy fatty fish like salmon, mackerel, herring. We want to focus on all of those amazing vegetables, mainly the cruciferous family, you know, those in the family with kale, cabbage, Brussels sprouts. These are all part of the cruciferous family, amazingly healthy veggies. We also wanted to take some fruit in our diet, and probably the healthiest fruits are going to be the berries, strawberries, blackberries, blueberries, raspberries. Those are very high in vitamin C and antioxidants. Those are really important. For men's reproductive health, sweet potato, even although its carb is actually very helpful. We also want to focus on eliminating alcohol on the egg provider and the carrier side. And on the sperm side, if a man has normal sperm parameters, he can probably have up to 5 alcoholic beverages in a week. But if there is an issue with sperm, you definitely want to then either have less than 5 or no alcohol, especially if you have very low sperm parameters. So definitely want to get off the alcohol. So gluten, dairy restriction, There's no real science to show that gluten and dairy restriction helps sperm parameters, but clearly the low carb, high protein, high veggie diet can help a man who is overweight bring his BMI down, because we know there's some pretty serious consequences to sperm production when a man is overweight. You get conversion of testosterone into estrogen in the peripheral fat, and that affects recruitment and manufacturing of sperm. We also want to talk about lifestyle. We also want to talk about things like acupuncture. Acupuncture can relieve stress. It can also increase blood flow to the organs in the pelvis. And acupuncture may be especially helpful around the time of an embryo transfer. Exercise, very important. Yoga, Pilates. For some people, it's running. For other people, it's working out in the gym, high impact, also working out on an elliptical or a treadmill. But you have to be exercising regularly to get your cardiovascular system going, and also to keep your BMI in the most optimum range. Now, when it comes to supplements, supplements are really important on both sides. We need the common supplements for both egg and sperm provider to be things like vitamin D, about 5,000 international units a day, CoQ10, about 400 milligrams a day. We want to also be taking a really good antioxidant. There are many of them. There's pycnogenol, resveratrol. I like acai because it's readily available in a powder form or a capsule. I think that's an amazing antioxidant. Turmeric as well. We also want to be taking omega-3 on both sides, the egg and the sperm provider, and omega-3 about 1,000 milligrams a day. But we can share all of these dosing schedules with you once you set up a consultation. So supplements really important. It's also important to work on the mind-body complex, because we know that stress is very intimately linked with firing up the immune system. And when the immune system is fired up, it can go into attack mode and can affect the quality of the eggs and then also the quality of implantation. And we're going to talk about the immunology of pregnancy towards the end of this presentation. So mind, body, really important, especially if you're finding that you have a lot of work-related stress or a lot of stress that has come about by, not being able to get pregnant easily. So, the way the stress works is it fires up things like natural killer cells and chemicals called cytokines. And these can actually work against successful implantation. Now, lifestyle, we've touched on BMI. When your BMI is elevated as the egg producer and the carrier, you may not ovulate if your BMI goes over a certain level. And it also increases the risk for you of gestational diabetes, of hypertension, and also of deep vein thrombosis and miscarriage. So BMI really important on the egg provider and the carrier side, because as the BMI goes up, the pregnancy rate per normal embryo goes down from a high of around 60% chance for a normal embryo when the BMI is normal to almost 15 to 20% for a normal embryo when the BMI is over 35. So can't stress how important BMI is. And I know it's hard to work on the BMI because, we have stresses around us. We also have, food that is just so rampantly available. One of the best strategies for decreasing the BMI without being hungry is to go as low on the carb as you can, maybe even to the point of a keto diet. Have lots of vegetables, lots of protein, and you will lose weight steadily and safely, and you will not be hungry. The other thing to remember is you need to have all the good fats in your diet. You need to be having things like olive oil on your salad. You can cook with olive oil or avocado oil. And the fruit avocado, one of the most amazing fruits, high in antioxidant supplements and those friendly fats that allow us to decrease our BMI without being hungry. I think it goes without saying that smoking is anathema when it comes to the quality of your sperm, the quality of your eggs, implantation, and then growth restriction on the baby. So if either party smokes, you've got to get off the cigarettes, whichever way you're going to do it. Some people, it's going to be cold turkey. Some people need help from their doctors with medication. But however you're going to do it, you just got to stop smoking. And that's covering everything. That's pipes and cigars and weed and cigarettes. Now, some people use legally medical marijuana, and outside of pregnancy, that may still be okay, but you should rather be taking that as an edible. You shouldn't be vaping or smoking because that's not good for your gametes. So we already touched on alcohol. So, why are we so passionate about the optimum health side of things? Because remember, fertility and specifically IVF is like a triathlon. It's not something you just hop on the bike or get on the track or start swimming. You have to train in order to get good results. So in order to get good results with fertility, with getting pregnant, whether it's naturally or through assisted reproduction, you've got to have a plan and you've got to go into training. So why are we so passionate about optimum health? So what are the benefits of optimum health? Basically, what optimum health does for us is it decreases inflammation in the body. And you do this by eliminating gluten, dairy, and sugar, except, of course, for Greek yogurt. You want to eat organic, you want to be on all of your supplements, and you want to incorporate all the lifestyle changes that we touched on: exercise, yoga. I didn't talk about meditation. That's really important. Some people do formal meditation. Some people meditate by exercising. But whichever way you do it, you've got to try and mitigate stress, because stress fires up the immune system, and that's negative for good reproduction. And we did acupuncture. I'm not going to beat the quit smoking anymore. And of course, no alcohol on the egg and carrying side and low alcohol on the sperm side. So that's the reason that we're so passionate about optimum health. So it doesn't mean that we just focus on the woo-hoo here. We focus on optimum health, and to that we add maximum science. Now, if you're up against a time constraint, in other words, you may have low egg reserve, you may be close to or over 40, and you don't have as much time, ovarian time, as you would like, we would have to try and do together the optimum health while we incorporate the maximum science. But I would like everybody to get at least 4 to 6 weeks of the optimum health under the belt before we actually embark on making embryos for you. Now, if we're going to make embryos, that stops the biological clock. If you still have work to do on your BMI, then what you can do is keep working on that, and we can delay putting the embryo back for you until you're in the best space that you can possibly be. So what do we bring to the table here under maximum science? We have state-of-the-art laboratories. The lab is basically almost clean room standard, and many of you here are involved in making chips or using chips. We have a dedicated HVAC system with two 15-ton HVACs on the roof. And what they do is they supply positive pressure, constant humidity and temperature in the lab, so that lab air is as clean as possible. We try to approach a class 100 room. And so state-of-the-art environment. We have a 150 kilowatt Caterpillar generator on the back lot here, so that if the power goes down, all of our vital equipment keeps going. And as long as we keep adding diesel to this huge generator, we can go days or a week if we have to. But fortunately, we've never had to go even as long as a day in the last 15 years that I've been in this location. We also have state-of-the-art equipment. We have tri-gas incubators. We have isolettes where we actually identify the eggs and manipulate the embryos. And I'm going to show you embryo biopsy and intracytoplasmic sperm injection in a few minutes. So the next breakthrough you know how long I've been doing IVF now. In the early days, we couldn't grow embryos to day 5. We grew them to day 1 initially, and then to day 3. And then the lab conditions improved. We were able to grow them all the way to day 5. But when we had to store embryos, all we had up until about 15 years ago was a method called the slow freeze. And when you slow freeze eggs, you lose 90% when you thaw them. When you slow freeze embryos, you lose 30% when you thaw them. Now, this next breakthrough, the flash freezing or vitrification, has raised the survival for eggs up to 90% survival. And on advanced embryos, the survival when you use vitrification is 98%. So this really has been a game changer for being able to store not only eggs and also to store embryos and to have almost no loss, over time. So let's talk a little bit about vitrification first. I'm going to talk about methods of isolating the very best sperm as well. And we use a technique called Zymote, which is a chip. I'm going to talk about pre-implantation genetic testing, which allows us to identify which embryos are normal and then to focus on putting back just one at a time. And the combination of being able to freeze with high success when we thaw them and to know which one is normal allows us to transfer one single normal embryo at a time for a very high pregnancy rate and almost no risk of twins. And we'll talk a little about twins because, when you've been struggling with infertility, a lot of times you think, oh, good, twins, we'll get 2 babies at once and then we'll be done. But it's not as easy as that because twins can be a twin pregnancy can be more complicated, both for the carrier and also for the babies, especially if the pregnancy ends as a preterm delivery. So we do try to avoid twins, and we'll talk more about that in a few minutes. And then we're going to talk about the immunology of pregnancy, the miracle of how this embryo that is genetically different from the mother implants and flourishes for 9 months and then ends up delivering. So let's look at vitrification here. So vitrification or the flash freezing is Japanese technology. The method we use is the method of Kitazato. The whole concept here is that the freezing happens so quickly that you have almost no time for ice crystals to form, because it's ice crystals that do the most damage to an egg or an embryo and caused us to have such dismal survival up until this method came along 15 years ago. We touched on the success rates here. And in fact, I'm going to show you how we do the vitrification, and you'll see that it's a pretty straightforward, simple method, and it's much simpler and quicker than the old slow freeze that we did for many, many years. So this is a picture of the little straw on which we place either the eggs or the embryo itself. And you can see there's a little yellow plastic stem about as thick as the inside of a ballpoint pen. And that little ribbon on the end is a nylon ribbon. And the magic of this ribbon is that nylon does not become brittle and break at temperatures of minus 196 Celsius, which is the temperature of liquid nitrogen. Because before we used to lose some eggs and embryos because the little vehicle we were storing them in used to become brittle and fracture and crack at those very low temperatures. So this is the little straw on which we put either a pair of eggs when we're banking eggs for people, or where we put a single normal tested embryo when we freeze embryos. So this is our lab supervisor, Alex Murphy. He's working at one of the stations, and we have 4 stations like this in our lab. And what he's doing is he's organizing either one embryo or a pair of eggs to be placed on the end of this little nylon ribbon and then flash frozen. So if you look at this video here, you'll see there's that little straw again, and you'll see the nylon ribbon in a minute, and you'll see our embryologist here doing the flash freeze or the vitrification for us. A pair of eggs is placed on the end of a nylon ribbon and flash frozen in milliseconds. This is vitrification. We are now seeing better than 95% survival when eggs are vitrified. With egg vitrification now, a woman can clearly stop the biological clock. Egg freezing has been all over the news recently, and for good reason. While men continue to produce sperm on a regular basis almost throughout their lifetimes, a woman is born with all the eggs she will ever have. At one time, this put women at a great disadvantage, but not anymore. For women who are focused on their careers, haven't found the right partner, or are not yet ready to start a family, egg vitrification is the perfect solution. Many women assume that egg freezing must be a lengthy and time-consuming process. In fact, after approximately 2 weeks of injectable medications, culminating in a 20-minute egg retrieval procedure, the eggs are in the lab and vitrified and ready to be stored. For some of our patients, this has now come full circle because we've been able to thaw vitrified eggs, make embryos, and allow them to have the baby they've always dreamed of. So that's vitrification, and as you can see, it's a pretty straightforward process. When we were first taught this process about 16 years ago, when it was just introduced, it was pretty scary to put a precious egg or pair of eggs or a precious embryo on the end of this little nylon ribbon and plunge it into liquid nitrogen, but it works beautifully. As soon as that gamete gets into the vapor above the liquid nitrogen, it's kind of spot welded onto that nylon ribbon, and it then goes into one of those big dewars or flasks with liquid nitrogen in it. And you can store an egg or an embryo for almost an unlimited amount of time because there's no metabolic activity that happens at minus 196 Celsius. So let's look now at how do we choose the absolute best sperm so that, we're working with optimum health to get the best egg and sperm to be produced. And now what we'd like to do, because we get presented with many millions or even hundreds of millions of sperm in one ejaculate. So we want to home in on those that have perfectly normal shape and those sperm that actually have the highest chance of being normal. So the Zymot process, and I'll show you the chip in a minute, it allows us to select the healthiest sperm. We get higher fertilization rates. We're able to pick the sperm with lower levels of DNA fragmentation. And at the end of the day, the embryo quality is also better. So this is what the chip looks like. So you can see this plastic chip. There's like a window with a membrane on it on the left-hand side. There's an inlet and an outlet port. So what we're going to do is we're going to take the sperm sample and we're going to concentrated. We're going to put that sperm sample into the inlet, and I'll show you what happens inside this chip. So once we put the sperm into this little chip, you can see the sperm goes into the lower chamber here, which is the blue chamber. And the dotted line here is the membrane, which has very small little pores in it, just big enough to allow the most vigorous swimmers and the swimmers with the most normal shape to get through. And we then go to the outlet port on this, and we're then able to harvest the top sperm in the batch. And then visually we can pick from that selected sample one perfectly normal shaped sperm at a time to inject into the mature egg. So this is the process of sperm selection, and there are a number of chips out there. The one we use at the moment is called Zymote. So once we've identified a sperm, once we get to identify your champions here, and we go to pick one sperm to inject into an egg, you remember seeing our lab supervisor, Alex Murphy, sitting at that station. That station would allow us to pick up one sperm and to inject it into the center of a mature egg. So this is what it looks like. So here you see a glass needle thinner than a human hair, and this is 400 times magnification. We hold onto the mature egg, and the needle goes through the zona or the outer shell, and it goes right into the cytoplasm or yolk of the egg. And we draw back just to be sure that we've actually punctured this membrane here. There's the sperm. And now we inject that sperm into the shell. And what happens is we then withdraw the needle. And you'd think that this egg might just collapse like you've punctured a balloon, but it doesn't do that, because the egg is like those run flat Michelin tires. You can get a puncture and it still allows you to get to the next station to be able to repair that. So the hole closes almost instantly. We only end up losing maybe about 1 in 1,000 eggs when we do the injection. And that's usually because the egg starts off being, a very poor quality and very fragile in the first place. So this is the process called ICSI. I'm going to just show it to you one more time. There you see Alex picks up that single sperm in that glass needle, and we're going to inject that through the zona into the yolk of the egg. And we draw back to be sure we've punctured that membrane. And then we're going to inject that sperm into the egg. And that egg is now fertilized. And about 70% of the time, the fertilization will work, which is the same as what we get with natural insemination when all factors are normal. And then that egg will then go on to divide and become an embryo. So that is ICSI, or intracytoplasmic sperm injection. The next breakthrough, once we've made the embryo, the next breakthrough is to be able to grow that embryo all the way through to day 5, which is called a blastocyst. And that embryo goes from a 1 cell on the first day when it's first injected to 150 to 200 cells. And there we're able to take 5 cells from the periphery of that embryo, and we can test those cells. And the most common test we do is to test for aneuploidy, or abnormalities of chromosomal number. And this is the same test we do when people have amniocentesis and you're looking to check for extra or missing chromosomes, or chromosomes with a deletion or a duplication. Now, some people have a single gene disorder that runs in the family. And if this is a dominant gene, you only need to get one of these genes into the embryo for that embryo to have that particular disease. If the disease is recessive, then both the egg and the sperm provider need to have that same abnormal gene for there to be a 1 in 4 chance of the embryo having that disease. So we can then also test for monogenic conditions. And so, sometimes we're treating people who don't have a fertility problem, but they have a nasty disease that runs in the family. And we can then identify embryos that are affected and choose not to work with them and to focus on transferring normal embryos. But more than 95% of the testing that we do is testing for aneuploidy or chromosomal number. And remember, this is not a test that is a 0 or a 1. It's not a test that is 100% accurate. It's a screening test, and it's a test that allows us to prioritize which embryos to transfer first. Because an embryo that passes the PGT, the aneuploid test, is probably better than 98% chance of actually being normal. And we can then look at the physical grade, and that way we can home in on putting in one normal embryo for you at a time. We still recommend doing a non-invasive prenatal test called the NIPT, which is a blood test at 10 weeks, to be sure that we're not in that 2% where this test may not be absolutely accurate. So let's have a look at PGT, or pre-implantation genetic testing. And this is what a blastocyst looks like on day 5. So what you can see is we're looking at a 200-cell embryo. On the left-hand side, that little clump of cells is the inner cell mass, and that's the part that goes to make the baby. And the cells around the outside will go to make the placenta. And what we're going to do is we're going to do a biopsy to take about 5 cells from the 180 that make up the precursor of the placenta, and we're going to analyze those to know which embryos are normal. So here's a video. Again, this is Alex working on that bench that you saw. He's going to put a needle into the center, the fluid-filled center of the blastocyst. He's going to remove a little bit of fluid, and he's going to place it between the embryo and the shell. So that's going to make a little space for us between the zona and the trophectoderm of the embryo. He's going to use this laser to do 2 little pulses, which will make a hole in the shell. And this is called assisted hatching. And what he's going to do is make a hole in the shell, and then he's going to put a little glass pipette through the hole, and he's going to suck up 5 cells, and we'll cut the little neck of that little bag off, and those cells go to the lab for analysis, and the embryo then gets frozen, waiting for the results to return. So, these movements are all geared through hydraulic little gears. So, these are hands doing all of this. So, the embryologists need to have really good hand-eye coordination. And there you see, we'll just power the laser up a couple of times, and then just cut that little sac off, and the 5 cells go into the lab for testing. And again, you'd think that the embryo would collapse, but it doesn't. But now it's ready for freezing. So this is the biopsy for PGT, or pre-implantation genetic testing. And there's our embryo ready to go into the vitrification process and to wait in the lab for the analysis. So far, these 2 advances, the vitrification, the flash freeze, and the ability to home in on which embryos are normal, allow us to pick one single best embryo to transfer, and that way we do what we call an SET, or a single embryo transfer. The chance of twins when you put in only one embryo is under 1%, and that only happens when that embryo splits. Just to give you some context here, before we could do this level of testing, let's say 15, 20 years ago, we used to put in 3 or 4 or 5 or even 6 embryos, especially if the egg provider was over 40. And a lot of times we didn't get a successful implantation, And every now and then we got a disastrous implantation where we got twins, triplets, quadruplets, or even more. So, thank goodness now we can home in on which embryos are normal. We get very good survival when we've frozen them and waited for the results. And we now have less than 2% of our pregnancies are twins versus 40% 15 to 20 years ago. And again, we mentioned earlier, a twin pregnancy might seem like a bonus, but definitely there are risks to the mother and risks to the babies. So vitrification PGT allows us to put in just one embryo at a time. So now we're going to talk for a few minutes on the immunology of pregnancy. Because remember, the egg and the sperm get together, they make an embryo. And when that embryo implants, it's called the conceptus because you have then a placenta and you have the part that's actually making the fetus or the baby. Now, in humans, you have to have an egg and a sperm to make an embryo at this time. So when you make an embryo, even if a woman provided the egg and she's carrying that embryo is always going to be genetically different from the mother carrying it because there's always going to be genetics from a sperm involved. So, why is it that the immune system tolerates this conceptus, which is essentially a transplant? It's really no different from a transplant like transplanting a heart or a kidney or a liver. And so let's dive into that and let's talk a little bit about this miracle upon a miracle, which is the immunology of pregnancy. We talk about pregnancy being a miracle. It is, and even more than we realize. The egg and the sperm get together and they form the conceptus, which is the fetus plus the placenta. What makes this a miracle on top of a miracle is the fact that the conceptus is genetically a mix of the sperm and the egg provider. It is in fact a transplant. The immune system patrols looking for invaders, which could be pathogens or non-self tissue. How is it that a woman can nurture a genetically different being inside of herself without rejection? If you think about it, we can't do things like organ transplants without having a close tissue match and taking immunosuppressant medications. So how do women do this? Women have evolved a remarkable ability to shield the developing baby from immune attack. Peter Medawar, working in England in the 1950s, was fascinated by this problem. He wondered to himself, how does the pregnant mother continue to nourish within itself for many weeks and months a fetus that is an antigenically foreign body? Without going into too much detail about a very complicated subject, there appear to be three main mechanisms which work together to pull off this miracle. The placenta acts as a physical barrier. The second is the antigens or protein markers on the conceptus may be immature and they may be shielded from the mother's immune system radar by the protein called HLA-G. The third is the fact that the mother's immune system may be temporarily downregulated and thereby giving the conceptus a pass. Here is a diagram of the placenta of a little mouse, which illustrates the first point for us. The blood of the mother and the fetus do not actually mix, but they flow alongside each other in the placenta. This facilitates the transfer of nutrients and oxygen to the fetus and the removal of metabolites and waste products, which are then excreted by the mother. This is what we mean by a relative physical barrier. This schematic shows how HLA-G could prevent the natural killer cells from attaching to the transplant and therefore blocks the ability of the NK cells to release toxins like TNF alpha and interferon gamma. If this elaborate method of protecting the transplant from being rejected does not work perfectly, it can either lead to failed implantation, early pregnancy loss, or later on intrauterine growth restriction, also called IUGR, or pregnancy-induced hypertension, also called PIH. If these three mechanisms work well, then the pregnant woman is in the nurturing or TH2 state on this schematic on your slide, whereas failure of any of these three mechanisms could move the patient into the TH1 state, which is hostile to pregnancy. The good news is that we can do testing which will tell us whether a woman falls on this spectrum and apply the necessary treatment. Sometimes infertility or recurrent loss is due to immune activation, and here are some of the tests that we can do to see if we are in the TH1 dominated state or not. So if you look at the list of tests, you can see we can test for a number of antibodies, anti-thyroid antibodies, anti-phospholipid antibodies. We can also test for cells, the natural killer cells that actually do the attacking on behalf of the immune system. And we can also check for cytokines. These are the toxic chemicals that natural killer cells release. And the two that we specifically look for are TNF alpha and interferon gamma. We can then add treatment accordingly. So you can see that, this is a really important area, especially for people who've had repeated pregnancy loss or people who've had repeated failed transfers. So this is definitely an area that we would focus on and look at for this specific group of patients. So you see the 800 number there. I would really love to do a consultation for anyone here on the webinar who hasn't already booked one of these. It's 800-800-1160. We'll have you come into the clinic so that we can look at your ovaries, get a handle on your egg reserve, do some tests for both the egg and the sperm provider, and then, aim to bring this dream that everybody has in working on either spontaneous conception or assisted conception. It still fills me with wonder and amazement every time we get an update on a birth, on somebody going to preschool, going to high school, going into college. This is not just a job. It's a way to do something for a patient or a couple that's forever life-altering. So I think we're almost at the time here to get to these questions. And remember, this is how you can contact us here. And I do look forward to speaking with each and every one of you. There's a question here about sending the PowerPoint to us. I think Lexi can maybe answer that. I think this session was recorded and maybe this will be available on the HRC website. Is that correct, Lexi?
Yes, I can definitely make sure that everybody has access to this because it was recorded. So
Thank you.
Yeah, of course. And Dr. Zouves, could you remind maybe write the number to call?
Sure. So the number for calling is 800 800 1160. And the website is goivf.com. And that will get you right to the picture you saw with the line of babies and right to the HRC and to my profile. So here's a question. It says, are there, Lexi, you want me to take these questions directly from the patients here? Because I can see them.
Yes, that's perfect.
Sure. So are there natural ways to improve the mother's immune response to create a more nurturing, less hostile environment for conception? Absolutely. So all the things that we were talking about, the supplements, including the antioxidants, the elimination of gluten and dairy, no alcohol, um, all of these factors will actually, and decreasing stress through acupuncture, exercise, meditation, all of those will decrease the natural killer activity back to a normal level and will make the immune system more accepting of an embryo when you get pregnant, whether it's naturally or whether it's through IVF. So do you have a similar webinar or more information about IUI as opposed to IVF? So, essentially, the optimum health is exactly the same, whether you're trying to get pregnant at home, whether you're going to be getting pregnant with a low level of stimulation like letrozole with or without IUI. There's absolutely no difference in the preparation. You should be doing, all of those things. With respect to IUI, if you've been trying for more than 1 year and you haven't had a positive pregnancy test, you can consider doing IUI first, but the IUI is very unlikely to be successful if you haven't had a positive pregnancy test together in 12 months. But, all the same things apply to IUI as they apply to IVF. Is it possible to get a written list of the supplements? You certainly can, but you need to do a consultation, and I will then be able to share that with you. So yes, absolutely, we do have a list, and there would be a standard list for egg providers and also, for sperm providers, and the list is very similar. And then on the egg providing side, some patients may have some, special additional supplements needed, especially if they have maybe polycystic ovarian syndrome or PCOS, which is a whole separate topic on its own. So here's a question which says, I once asked a holistic doctor who in general is anti-meds and anti-vaccines, his opinion about egg freezing, and he said he's completely against it because the medication causes many women to become psychotic due to hormone changes. What's your opinion on that? Gee, I don't even think I'm going to touch that because, vaccinations saved us in the last 5 years. And we all need some form of medication at some time. Otherwise, we may, we'd take a step backwards to the days before antibiotics, and we would all die from a ruptured appendix or from a pneumonia. So I haven't seen people become psychotic due to hormonal changes when they have, made eggs or embryos. So that would be my take on that. Do you have any advice regarding herbal medicine recommended by an acupuncturist, fertility focused? I do. I strongly support acupuncture and traditional Chinese medicine, especially as you point out in your question here, that you're working with somebody who's familiar with fertility and focused on it. Traditional Chinese medicine and acupuncture has been around for like 5,000 or 6,000 years. Who are we to second guess it just because we don't understand how it works? So yeah, I'm strongly supportive of not only the acupuncture but the TCM as well. So let's see. What's the next question? Yeah, Lexi was talking about a discount. Maybe you want to speak to that, Lexi. Oh, there you go. There's the answer. So pretty hefty discount there. When you sign up and speak, we'll also have you speak to somebody here in our financial department as soon as we know exactly what modality of treatment is going to be good for you. So, is it safe to take Dupixent when trying to conceive? Now, there's a whole family of medications called the biologicals, and patients with identified targeted autoimmune diseases, like inflammatory bowel disease, like SLE, like rheumatoid arthritis, some of them actually need these biologicals to actually have a reasonable life free of pain and bad symptoms. Now, because I've been involved with immunology of pregnancy for all of these last 30 years, sometimes we have patients who don't have an identified target where you could say they have this specific autoimmune disease, but they have significant autoimmune activation. We would sometimes even use some of these biologicals, things like Humira, like Enbrel in the older days, because that's every 4 days, whereas Humira's every 2 weeks. So we use these medications, yes, if you're on them for an autoimmune disease, as long as that particular biological is known to be safe in pregnancy, you can stay on it. What is the success rate of Clomid and IUI? So, that's really a very loaded question, because it depends on a lot of things. It depends on the age of the woman who's going to provide the egg. It depends on her egg reserve, whether you can actually generate a follicle. It also depends a little on the quality of the sperm, and also depends probably largely on how long that couple has been trying, and without actually having a positive test. So very hard to put a number on it, but I think if you've been trying for longer than 12 months, probably the best number on an IUI cycle is going to be around 10%. Is infrared sauna okay when trying to conceive? So I think the infrared, the two spectrums of infrared light when applied to the skin can be anti-inflammatory and can be good for increasing blood flow, can be good for fertility. As far as a sauna goes, if a sauna, whether it's infrared or whether it's a traditional steam sauna, if it pushes your core temperature significantly over 40 degrees Celsius, 40 degrees Celsius, that can damage eggs, especially during the stimulation phase, and that can also adversely affect the sperm. So I would say infrared light to the abdomen, to the lower abdominal region, can definitely be helpful. Total body exposure, you'd obviously need to protect your eyes, but as long as it wasn't pushing your core temperature over 40, I think it should be beneficial. What are the causes of low AMH? Boy, you guys are asking amazing questions tonight. So AMH is anti-Mullerian hormone, and it's not as if there's something that actually decreases the AMH. The AMH is a measure directly proportional to how many eggs are left in the ovaries. So the bigger your egg reserve, the larger will your AMH number be. Now, as we get to the menopause, where periods stop, and on average in this country, it's age 51, the AMH will get lower and lower and lower. And when you actually run out of eggs and your periods stop, your AMH is going to be as close to zero as you can get. Now, sometimes patients with very high egg reserve, like patients with polycystic ovaries or polycystic ovarian syndrome, they can have an AMH level of somewhere around maybe 8, 10, 11. And in fact, I'm doing an egg retrieval tomorrow on somebody with 60 follicles, and she has an AMH that's in the teens. But usually an AMH level of 2 and above is a very good number, and an AMH between 1 and 2 is okay. And as it gets below 1, then that's telling us that we're getting to the end of the egg supply. So it's not as if something causes the AMH to be low. It's a measure of how many eggs are left. Now, there's one caveat to that. If a woman has been on the pill for 5 or 10 years, kind of almost consecutively, you can have a falsely low AMH when you measure it. And when you come off the pill within 4 to 6 weeks, that AMH may come up. And it's not that it's a bad thing to be on the pill for that long. There are actually major reproductive benefits to being on the pill long term. So those of you who've been on the pill for many, many years, don't feel as though you've done yourselves a disservice. What AMH number would you suggest a single 40-year-old consider egg freezing? Well, of course, the higher the number, the better, because it means you're going to make more eggs. Now, if your AMH is low, if it's significantly under 1, you want to be doing an ultrasound on the 2nd or 3rd day of your cycle to look at the ovaries and count the number of resting follicles. And that will give you a rough idea of how many eggs you can produce. Now, usually you'd like to have at least 20 mature eggs in the bank to have a good chance of having one baby. Unfortunately, as you get beyond 40 and as you get closer to age 45, even if you make a lot of eggs, you're then going to be up against the majority of those being abnormal, because by the time we get to age 45, each blastocyst that you can make will probably only have about a 5 to 10% chance of being normal. So what is the typical timeline between an initial consultation and the start of treatment? So let's say you're on this webinar, you sign up, we do a consultation. It might take a week or 10 days to get the appointment. We'll see you, do ultrasound and blood work in the next couple of weeks after that. So once we get all those test results back, we could be actually initiating stimulation and treatment for you about 6 to 8 weeks after you first sign up for a consultation. That would be the absolute quickest. Now, if you're only planning to start treatment next year, I wouldn't wait on a consultation. I would do the consultation now. Let's get you really on the path of optimum health. And we can give you a list of tests that you can actually start doing, many of them through your primary gynecologist, or we can get them done for you as well. If we're in network and you have insurance that will cover that for you. And your testing should all be good for at least 6 to 12 months. So don't hold back on the consultation here. Do the consultation even if you're not quite ready to do the cycle. So any expiration for the discount? I think Lexi addressed that. So guys, we're kind of just over the hour here. I think we're out of questions here. I hope you guys have enjoyed this presentation as much as I have enjoyed presenting it. And I do look forward to speaking to each and every one of you. Remember, COVID hasn't disappeared. I just had a patient yesterday who arrived with a positive COVID test as we were wheeling her into the operating room. And that was yesterday. That was Tuesday, this month of August. So COVID is still all around us. If you're planning to be pregnant, I would urge you to get vaccinated, because if you're pregnant and you get COVID, it's usually a more severe disease. So again, thank you very much for your attention here. You guys